Hello everyone, my name is Chloe. I'm a junior in the health science program, and in the fall I will be studying OT. So the article I decided to read was titled Inflammatory Bowel Disease Activity in Patients Undergoing Pelvic Radiation. So the purpose of this study was to see if patients with ulcerative colitis and Crohn's disease could safely receive pelvic radiation therapy with an acceptable toxicity. So what the acceptable toxicity means is that the patient would experience little to no flare-ups or bowel issues while doing the radiation therapy. So the researchers in the study performed a retrospective analysis that followed 28 patients with Crohn's or colitis through treatment and afterwards. So the way that they kind of evaluated who was going to be in the study was they gained information from the medical charts of the patients with the irritable bowel diseases who are also receiving either external beam radiation therapy or brachytherapy or both therapies for pelvic neoplasms, which like cancer, such as digestive, urological, and gynecological cancers. They wanted to look at 3 different areas through the findings. They wanted to look at cancer treatment, IBD activity, and IBD toxicity. And they conducted a series of tests that tested for all of those things. But what they found was that the radiation therapy worked for most individuals with irritable bowel disease, which they didn't think worked because one of the signs of a flare-up can sometimes be hospitalization stays. And what they also found was 60% of the study population was considered IBD in remission 6 months after receiving the radiation therapy treatment. And the GI toxicity and flare-ups and bowel issues were found to be extremely low in most cases. So that's really good. The way that they conducted this study, they used both a quantitative and qualitative approach to the study. So the quantitative part of the study was that they wanted maximum IBD activity, they were tracking for that, and maximum GI toxicity. And that they studied the GI toxicity within treatment and after 6 months from the beginning of the RT. And they also wanted to look at kind of the person with the Crohn's and colitis. They wanted to test for tobacco smoking to see if the person receiving the radiation therapy smoked. They wanted to test for the type of IBD, so ulcerative colitis or Crohn's disease. They wanted to know the IBD location, whether it was in the rectum, the small intestines, or the colon. And they wanted to know the type of tumor that was being treated with the radiation therapy. So they looked for if it was in the prostate, the cervix, endometrium cancer, or other anal cancers. And they looked at the RT treatment characteristics, which would be the EBRT and the BAC2. And so they tested for all those things and found it worked for most individuals, which is great. And so for future studies, the researchers would like to see more tests done to see what could minimize the toxicity even more, even though it was already pretty low. Awesome. Well, I look forward to meeting you all. Thanks. Bye.